It's been really exciting for GreenSpace to see the continued momentum for measurement-based care. When our co-founders started GreenSpace, measurement-based care was not widely used in clinical practice, especially not in child and youth services. It's now recognized as a foundational component of high-quality, evidence-based care by the APA and accrediting bodies like the Joint Commission and CARF, who we're fortunate enough to be able to hear from today.
If you don't measure something, you really can't improve it, right? Peter Drucker said that you can't improve what you don't measure. And so when I see measurement-based care, when I see measurement-informed care, it's really that kind of hits home with me. Quick story, when I was in the field, I was a therapist. I was working with the teens and the adolescents because I love that population. And I was using the outcome rating scale and the session rating scale. I remember one of them, his presenting concern was that he had been experiencing really high levels of anxiety. And one of those episodes actually resulted in him being hospitalized. And those tools really became a way for him to be able to better express himself and to feel really comfortable sharing his wants and needs.
MBC offers kind of that ability to kind of, if in doubt, zoom out. And I think it helps the teen see their own data, not the clinician or someone else saying, no, I think you're doing better, and balance out or maybe, kind of soften some of their cognitive reviews of how things are going. For teens, particularly with their autonomy needs, the fact that they're able to look at their own ratings, I think is significant and helps the clinical process as well.
Clinicians, and I would even say in particular child and adolescent clinicians, have a really difficult job of working with systems and working with a lot of different information. We have seen tremendous value in bringing data to them that they see as telling a story that they can build upon, that gives them perspectives into their work and make their work easier.
Often in implementation, a big piece of it is ensuring that the way in which leadership introduces measurement-based care is based on the value from a clinical perspective. So you might have to do this for CARF from an accreditation perspective, but that's not the reason why measurement-based care is going to be helpful. There's a ton of value that is providing to the clinician directly.
Spending the time to really work with your clinicians around this is valuable, so they don't see it as being done to, they see it as part of a value proposition for them.
We kind of launched a measurement-based care kind of pilot project, if you will, and particularly using GreenSpace with a grant-funded, community-based parenting program. And hopefully from there, our vision was to then extend to the child clinic. I'm happy to report, we just last week found out we are going to be able to roll this out in the clinic, but it made it much easier to go back to the agencies that were supporting this and say, look, 70% of our, kids are showing reliable improvement on this measure from before and after.
The final thing I say is value-based payment models are not going away. I see this as a very good thing, using data, both cost data and clinical data, to say, if we get these dollars, these are the outcomes we can create, these are the outcomes we can move towards, and these are the things we need, like GreenSpace, so that we can deliver the highest quality of care.
It's been an absolute pleasure to host the discussion with such an accomplished group, and I really appreciate the lessons learned and willingness from each of you to participate with us. So thank you, everyone. Have a wonderful day and rest of the week, and all the best.